Your heart beats over 100,000 times a day, pumping 5 liters of blood every single minute. Unlike skin or bone, damaged heart muscle cannot repair itself. This leaves transplant as the ultimate cure.
Doctors match recipients with donors who share compatible blood types and tissue antigens to prevent rejection.
The donor heart is cooled in ice slush and preservation solution, stopping its beat for safe transport. A donor heart remains viable for only a few hours outside the body, making speed vital.
In surgery, an incision down the chest opens the rib cage to expose the failing heart.
A cardiopulmonary bypass machine takes over, keeping blood flowing throughout the body. Surgeons meticulously sew the donor heart into place, connecting each vessel with extreme precision. As blood flows back into the aorta, the new heart begins beating on its own. Post-surgery, daily medications suppress the immune system, helping the body accept its new life-saving heart.